The Philips Telemetry Monitor 5500, also called the 5500, provides continuous monitoring of ECG. Depending on the model and the software, the 5500 can also monitor oxygen saturation and respiration. The 5500 makes it easy to view the patient data that you need. Begin by cleaning the patient's skin in preparation to apply the ECG electrodes. After checking for moist gel, place the electrodes on the patient according to the lead placement that you have chosen. The 5500 supports 3-wire, 5-wire standard, 5-wire EASI, and 6-wire configurations. The 5500 derives the respiratory measurement and waveform using the RA and LL leads on the patient's chest. If you want to measure respiration and you're already measuring ECG, you may need to optimize placement of the two electrodes between which respirations will be measured. Repositioning ECG electrodes from standard positions, especially when you're using EASI placement, results in changes in the ECG waveform and may influence ST interpretation. If your model includes SpO2 monitoring, apply the SpO2 sensor to the patient. When applying the sensor, ensure that the application site matches the sensor size so that the sensor neither falls off nor applies excessive pressure. Check that the light emitter and the photodetector are directly opposite each other. All light from the emitter must pass through the patient. Then, connect the SpO2 cable to the 5500 patient cable. When the SpO2 cable and ECG lead wires have been connected to the Telemetry Monitor 5500 patient cable, connect the patient cable to the 5500. To avoid dislodging the connections in the patient cable, use a straight-on approach when attaching. A slight clicking sound signifies that the cable is securely connected. Insert the battery to power the 5500 on. After completing startup, ECG waveforms and numerics will display. If your device is configured for multi-lead analysis, the 5500 uses the primary and secondary lead to compute heart rate and analyze and detect arrhythmias. Only the primary lead is used if your device is configured for single lead arrhythmia analysis. The analysis mode, as well as the primary and secondary lead, must be selected at Pick IX. If the SpO2 measurement is in continuous or auto mode, the SpO2 measurement will display automatically. If the SpO2 measurement is in manual mode, measurement must be started at either the 5500 or Pick IX. Select the numeric, then select Start SpO2 from the Setup menu. Pulse is derived from the SpO2 measurement, and the pulse numeric is displayed when SpO2 is being measured in any mode. When in auto or manual mode, pulse measurements are displayed with a timestamp. When the SpO2 is in continuous mode, a pleth wave may be displayed. The 5500 display can operate in 6 different screen views, each showing different waveforms and numerics. Move between the displays by selecting the main screen button. To display a different measurement, select the measurement that is currently displayed, and then select Change Numeric. You can change the waveform that's displayed in a similar way. Select the waveform, then choose the waveform that you want to display from the Change Wave menu. The 5500 makes it easy to display the patient data that you need. To learn more about applying electrodes, the SpO2 sensor, or adjusting the monitor display, reference the instructions for use. Philips.